The Plague Doctor versus the Black Death. The Black Death was a devastating plague epidemic that ravaged Europe in the 14th century, killing, according to various estimates, between 60 and 200 million people. Causes and spread of the Black Death. The plague was caused by the bacterium Yersinia pestis, transmitted by fleas that parasitized rodents, rats, ground squirrels. The epidemic began in Asia and spread along trade routes, including the Crimea and the Mediterranean. The plague reached Europe in 1347, and by 1348 had engulfed most of the continent. Symptoms included fever, the formation of buboes, swollen lymph nodes, skin blackening, and rapid disease progression. Mortality rates reached 60 to 70% for the bubonic form and nearly 100% for the pneumonic form. The role of plague doctors. Plague doctors were specially appointed physicians who treated patients and organized sanitary measures. Their role began in the mid-13th century at the initiative of Pope Clement VI, who introduced the position during the Avignon epidemic. The duties of plague doctors included treating patients, though methods were often ineffective, collecting data on disease spread and maintaining mortality statistics, organizing funerals and quarantine measures, advising city authorities on health matters. The plague doctor's costume was designed to protect against supposed sources of infection, miasms, harmful vapors. It included a long cloak made of leather or wax-impregnated fabric, a mask with a long beak filled with aromatic herbs and spices to filter the air, gloves, high boots, and a staff for examining patients without direct contact. Treatment methods and their ineffectiveness. Medieval understanding of disease was based on the theory of miasms, not on bacterial infection. As a result, methods were used that seem absurd today. Bloodletting and cauterization of buboes, believed to remove plague poison, but often led to greater infection spread. Use of leeches and frogs on affected body areas, aromatic substances and incense to purify the air, garlic as a preventative measure. These methods not only failed to help, but sometimes worsened the situation. For example, unsterilized instruments during bubo incisions facilitated infection. Consequences and historical significance. Although plague doctors' efforts did not lead to significant breakthroughs in plague treatment, their work had important implications. They contributed to the development of sanitary measures, quarantine, and disease statistics. Their experience influenced future approaches to public health organization. The epidemic triggered social, economic, and cultural changes, including increased unsanitary conditions and religious fanaticism. The Black Death left a profound mark on history, altering demographics, social structures, and European worldviews. Despite the efforts of plague doctors, real control over the plague only became possible after the discovery of the disease's causative agent in the 19th century and the development of antibiotics in the 20th century. Thus, plague doctors were a symbol of the struggle against the unknown, but their methods reflected the limitations of medical knowledge at the time. Although their efforts did not save many lives, they laid the foundations for future achievements in public health.